you for joining us. We'll just give everyone a couple of minutes. I'm not sure Joe has joined it yet, who's doing the training, so just wait another minute or so. Thank you. Right, so hi everybody. Oh, I put my camera on. We're just going to start now in a minute. I think Joe's joined us. So I'm Candy. I'm a project manager at RM Partners. Can I just ask that everybody can put their turn their cameras off and make sure they're on mute, please, just so that we don't get people's faces filling up the screen. But thank you for being here. So I'm from RM Partners, and this is a training session that's being led by Joe from West London IT. And this is for the new cancer screening dashboard for South West London for bowel and cervical. Some of you might have been hearing about it for a little while, but it's taken a while to sort of complete and get the data validated. In terms of the data, there is still a little more signing off to do, so please bear with us on that. But this is today to show you the functionality of it and what it will look like and how you can use it for reports, etc. Previously, you might have had access to the RM Partners dashboard, which we use in meetings and the cancer clinical leads would use when meeting with you. But this dashboard gives much more insight around the populations of your practices and PCNs, so that you can understand, filter by sort of ethnicity, long-term conditions, demographics, etc. So that we hope going forward you can do pockets of work to sort of understand those groups that don't come forward for screening, etc. And so, you know, work can be done around that. So without further ado, I will let Joe take over. If there's any questions, please put them in the chat. This session is recorded and we will circulate it afterwards. So if any of your colleagues aren't here today, then please forward it on when you receive it. Thanks very much. And can I remind everyone again to turn off their cameras and put themselves on mute, please?
Good afternoon. So if you've met me before, my name's Joe and I'm the lead analyst sort of for cancer in the South West London analytics team. We're not the ICT team, but we do work really closely with them. If you've got questions about sort of access, then that's them. If it's about the data, then it comes to analytics. So as I said, I'm going to run through sort of the dashboard. We'll cover access at the end and how you can get into it. You'll have the right to access it. We just need to know who you are. But I'll run through where it is, how you use it, sort of what your few use cases might be, commonly asked questions, and then we'll just do a quick Q&A at the end. Feel free to drop questions in the chat and I'll work through them once I've finished the first part of the demo. I think it's the best way of doing this. Okay, so all of our reporting is hosted on our SharePoint website, which is through this link, which I'll put in the chat at the end with all the links you need to follow. And once you're in, you can just search the website for anything that's of interest to you, or just use the navigation here. So for cancer, everything is on the cancer page, which you navigate just by clicking this. So there's a cancer dashboard that's around sort of activity, which we'll just minimize that for now. And we're going to look at the cancer screening dashboard. So the explanation bit sort of just says that we're covering 2 cancer screen programs at the moment. So we're doing cervical and bowel. In the pipeline, we would like to include breast screening as the 3rd program, but that's quite a way off yet. This sort of explains to you sort of the metadata around the reporting. So the main one to look at is the update cycle. So the data in this dashboard is going to change every month. It uses primary care data, which is listed here, and that's why we are running a monthly process. It tells you who we cover. So most of our reports are just our population. Sometimes it's our providers. It sort of depends on the nuances of each dashboard. But once you scroll down to it, you'll see it embedded in the web page here. And if you're happy to use it at this size, you can navigate on the left, or you can just make it full screen. So I'm going to do that now so that you can see it better. And at this point, you navigate just by using these little buttons at the bottom. So we'll just click through to the next slide. So what we've done is we've split up the dashboard into the screening programs. And because the screening rules are a bit different for the 2 different age groups in cervical, we're treating them as if they were different programs because of the length of time that you need to be screened for. But each of the 3 programs is reported in the same way. So we'll just go through one of them in detail, and it's the same for the other 3. So if I click on cervical screening 2749, this is what the front page looks like. It's a little bit performance-y. So what we're seeing is the number of patients who are currently eligible for their screening. These are patients that have been screened within the right time frame. These are the ones that haven't. And this gives us our performance for each borough. We've RAG rated all the practices for the target. So 55%, 55 to 65, and over 65% being achieving the target that we want. And then we start to get into demographics. So we pulled the age band out for the patients, which is based on their GP practice record, their ethnicity. We pull from across the system, so it's a pretty much complete coverage of where our patients are from and how they identify. Deprivation, where 1 is the most deprived. So a note around number 1 in South London, very, very low cohorts. So if you hover over any of these bars, you can see the underlying numbers. So in cohort 1, there's actually only 11 people. It's a very small cohort, but all the other cohorts have got significant numbers. So that's there so you can know, is it actually a strong message to take away, or is it just because there's a very small number of patients in any of these groups? This lets you compare GP practices on the right-hand side. And the way our reports work is that we work from the patient record up. So anyone in South West London is in here, and we build it up from that. So if you want to look at just your borough, you can just pick that. So at the moment it's set to Wandsworth, and it's now essentially a Wandsworth dashboard with the other boroughs here for a comparison. If I'm just going to pick a PCN, so I'll pick Brocklebank. So now I've got a Brocklebank PCN dashboard. So I can see about the 3 practices in that PCN and the profile of their population and the screening uptakes that we've got. If you're working at like a wider level and you want a specific sort of health group, so we'll remove all of our primary care, and from the side, say we want to know people who are in the core 20. So I can just tick the core 20% most deprived. And that's now what I'm seeing. So because it's from a patient level, the NHS England reporting, which you've been aiming to match with, is at an aggregate level for GP practice. So we're trying to match to that. And the upside of this is that we've got much better granularity around who our patients are and how they interact with the system. So we can look at their multimorbidity, how many long-term conditions do our patients have? Does that affect their screening uptake? Their risk of admission score? If we just pick our riskiest patients, what's their screening uptake like? And this lets you sort of to inform campaigns locally, or have a much better understanding of who it is that isn't receiving their screening. The second page for each program is where we start to do a bit of population health. So we're looking at which long-term conditions do or don't have screening at the higher rates. So we've got long-term conditions, the age profile, the breakdown of the ethnicity. So the previous page was just the 5 main groups. Here we've broken it down to the lowest level that NHS Digital lets us go to. And you can immediately see that there's a big difference in ethnicity uptake for cervical screening. And here we've matched deprivation against uptake. So you're seeing deprivation uptake is quite similar until you get to about 5, and then it increases. So there is a clear trend where the more deprived groups are having a lower uptake of their screening. There is a user guide for this that will be on the website just below the dashboard. It sort of talks through how to sort the graphs. So you can sort graphs just if I click a graph. This one, I can make it bigger. And then once I'm here, I can sort it if I want to sort it by, I flip it to see who's not been screened. I can do that. And you can export any number. So any graph that you see, you can export it either as a picture or the underlying numbers into an Excel file. And then you can either keep that as a record or manipulate it yourself for presentations or PowerPoints, whatever you want to do with the numbers. You will have the guide will tell you how to do all that. And that's been developed with RMP to try and cover off as many use cases as we could think of for access. But if you've got any more questions with it, I'm going to put all the links in the chat at the end. And you can just drop the analytics inbox a question that you've got and someone will get back to you. I'm not going to dwell on the other programs because it is the same page 3 times, but it is essentially the same process. So pick your screening program you're interested in. Either put your primary care geography through the top, any patient filters on the right, and then you can extract or screenshot appropriately. I'm going to talk through the report notes because this is quite important to focus on because we are using GP data. So we've put a 6-month lag into the data to ensure that patients who've been sent a screening kit but just haven't responded yet aren't considered as a non-responder. So if you were sent the screening kit, if you became eligible, say on the 1st of January, and you sent your kit in February, we wouldn't mark you as a non-responder until the 1st of July, because that gives the patients the time to feedback and for GPs to get the information coded and for it to be extracted and pushed through into our dashboards. That means there's a bit of a lag, but the NHS England lag, I think, is about 18 months. So we are still much more up to date and a greater granularity than the national performance reporting. There is a note against GP data in general. We are affected by GP opt-outs. So where patients don't want their medical records shared, I will see them as a non-responder, even though they might have had their screening. So that's the if you're seeing particularly low numbers and you know your GP practice has a high opt-out rate, and we have a report for that, so we can let you see your GP practice opt-out rate. That would explain why you're not seeing the numbers that you would want to see in the dashboard. So these could be these 11 practices currently excluded because the numbers are lower than we believe they are based on national data. So these could be a mix of local coding practices where they're using slightly different SNOMED codes to the rest of South London, or they've got a very high opt-out rate, which is affecting the data that we're seeing. Just gonna, so that will explain what, and again, I'll put the link to the opt-out dashboard in the chat as well, so you can see that. That is a whistle-stop tour of the screen dashboard. Let's go back to the first page where we sort of explain the program. So the only thing I think to note is the age band. So the cervical program is 25 to 49, but we've excluded 26-year-olds, 25 to 26-year-olds because they aren't being invited in the first year for most of South London, and it means that as a result we're not matching back to the national numbers, which we're trying to benchmark ourselves against. So it's not a performance dashboard, but we want it to be closer to the performance dashboard that we can use it locally to then drive improvement in the national reporting for this. Okay. So I think what I'll do then is just start with questions in the chat, and anyone can just put a hand up if they want to ask something specific.
Joe,
so
do you
Sam,
want me to read them out to you?
Okay. I can see it. I've got a few screens. So Sam says, how is deprivation coding picked up from the primary care data? Okay, so for every patient that is registered with a GP practice, we have their address, not their exact address, but we have their LSOA code from their primary care record. And that's what we match against. So there's a national deprivation sort of index that's applied nationally across the country. So as long as the patient has an address in their GP system, we can assign them a deprivation based on where they live. Sam again says, does the non-responder coding require specific on GP practice, or do you pick this up directly from results pages in EMIS? So we don't have a direct connection to EMIS. Where it works is that a third party sort of extract GP records by SNOMED code and give it to us. We did consider doing people coded as non-responders, but then we were left with patients with no codes, and you'd have sort of 3 categories. So what we did is we just take the population, and then we mark those where we've got a responded code, either a generic responded code, a responded like good result or bad result. They're our screened cohort, and everybody else is our unscreened cohort. So we're not looking for a non-responder code specifically, because in theory everyone should be eligible unless they've been excluded. I know for cervical we have an exclusion criteria for people who aren't suitable for cervical screening. So again, as long as that's coded, they won't be included in our denominator. Finula says all patients are invited for smear at 24.5 letter%. I don't know the specifics of the invite program. When we looked at the numbers, you don't start to see representative until sort of 26 years old. So that's why we've delayed it a year, just so it matches back. Naomi says, I noticed that joint health is part of the 11 group. How do we get included back into these boards? Okay, so if you are on this list, I think the best thing to do is to email the analytics web email address. I'll put it in the chat. And just get in touch. And what we basically need to do is we will have to have a meeting where I'll say, well, these are the numbers that I can see. Can you look on your system, tell me what you think your numbers are, and let's look at which codes we're looking for. Because it could be that you're using different codes, or you've got a very high opt-out rate, which off the top of my head, I don't think the junction does. So just get in touch and we'll go through that. Maria says, can you get a list of non-responders in groups for the site, or do you have to do your own searches? Okay, so this dashboard doesn't do patient re-identification. It is a capability that we have. It wasn't really requested because Marsden partners wouldn't be able to re-identify as a provider, but primary care can. So it's something that we can look into. I think if there's enough demand for it, then Candy and Sadia from Marsden can pick that up as something to request. So for any given practice, we would be able to tell you who we think hasn't been screened as a list, and then you'd be able to check your records and contact them as such. Sam says, has there been examples of how this system has been used in a targeted way to improve uptake for screening in low uptake population providers? So no, not for cancer screening, but we have done an almost identical project for vaccinations. So childhood vaccinations and flu vaccinations has been running for a few years now. I think the winter of 2020 to 2021 was the first time we launched a program like this that covered flu vaccinations. And that was used by borough teams to target geographical areas with public health and PCNs with primary care teams that weren't showing uptake in the right age groups. So I believe the process does work. We haven't tried it for cancer screening because this is a new project for us, but I don't see any reason why it can't work in the same way that vaccinations has. Katie Unverified says we're on the exclusion list. Just email the analytics inbox and say who your GP, which GP practice you're from, and then we'll try and set up a meeting to work through how we can get the coding back into a place where it is, because we don't want to include practices where the screening rate is something like 5 or 10%, because we know it's not that, but that's what the data is telling us, and we don't feel that we can include that because the wrong messaging will come out. And borough teams will be telling GPs that they've only screened 10% of the population, which won't be true. So it's to get ahead of that. Okay, so I'm going to put in the chat now. There's the inbox for the support team, so they'll help you with the access to the website if you're getting any error messages. So those are your 3 links. So that's the help team, the analytics inbox for questions around the dashboard, how to use it. And sort of, again, if you're on this exclusion list and you want to understand why, and then a link to this page itself. And the user guide will go here, just below it, once I get that signed off. And then hopefully, so the access is open to anyone who is employed under the South West London NHS umbrella. So anyone from primary care is eligible for access. We need to know who you are, and that's what the support teams email us for. So email them and say, I work for this GP practice, can I have access to the South West London Analytics website? And they will send you, they'll approve your access and send you the links to get started. but there's no logins. You don't need a login or a password. It's just your email address that you have, that you register with. Will public health have access? Yes. So public health are under our data sharing arrangement. They see pretty much the entire website, including cancer screening. So that's why we've got resident borough at the side and electoral wards to help our public health colleagues use it in the way that they work, rather than the primary care aspect that I think most of this meeting will be working on. So we try to do both approaches. We work for both primary care and for public health. No worries, Daniel. Are there any other questions?
Okay, great. Well, thanks, Joe. Thankfully, that was short and sweet, so most people get a bit of time back. So if you joined us late, just to say again that this has been recorded, and we will send it round either via email, or Sophie will put it in the usual South West London comms. And if you've got any questions outside of access and anything, then please you know, by all means, contact me at RM Partners, and I'll send my email address with the comms as well. Oh, Claire, do you want to say something before we finish?
I was just going to say, Candy, that in relation to breast cancer screening, there's a kind of an ongoing issue in relation to data with the hub. So our informatics team is working with the hub informatics team and IG team. We hope that breast screening data will be on here soon. This is an issue both in Northwest London as well as Southwest London. It's not specifically a dashboard issue, it's an IG issue. So hopefully maybe in Q1, if not then maybe Q2, we will be able to add the breast screening data to this as well.
Great, thank you very much. So just to say that perhaps we can run another session in a few months' time for any missed colleagues, and you know, if people are using it and sort of need to know a bit more about it. But otherwise, yeah, we'll send around the training, and as Joe mentioned, there's the user guide as well. Okay, great. Thanks very much for joining us, and take care. Thank you.